Welcome to the Convergence Health CPHQ exam prep course. This is session 1. This is the only session that's going to be on demand and free of charge to anyone who's interested. So I hope you'll follow along for about the next 35 minutes or so as we get into the initial parts of the CPHQ exam. Now, before we get started, I want to introduce myself. I'm Kim Werkmeister. I'm the Senior Vice President of Improvement and Implementation at Convergence Health. Welcome to our CPHQ Success Sprint. As we begin this focused journey towards your certification, I want to acknowledge something that we all know firsthand. Healthcare quality is experiencing unprecedented transformation, with the Department of Health and Human Services and all of the agencies under it implementing new operational frameworks and shifting priorities. The landscape for quality and patient safety regulations and support that we navigate daily continues to evolve rapidly. In this sea of change, there's one constant that remains: the critical importance of healthcare quality professionals like you. In fact, organizations now recognize that professionals with a strong quality toolkit embodied by the gold standard CPHQ certification are invaluable leaders in navigating these transitions. That's precisely why we've designed this efficient, expert-led program to equip you with everything needed to validate your expertise through certification without requiring weeks away from your responsibilities or thousands of dollars from your budget. Over the next few days, my colleague Jen Wagner and I will comprehensively cover all CPHQ exam domains while providing you with proven strategies that have helped hundreds and hundreds and hundreds of professionals successfully earn their credentials. And we will do so by providing practical guidance and real-world examples from our decades in healthcare quality to make the content come alive. Whether you're looking to advance your career, validate your expertise, or simply gain confidence in your quality improvement knowledge, the path we're starting right now will help you reach those goals efficiently and effectively. As quality professionals across the U.S. who have taken our course have consistently reported, this certification preparation truly delivers measurable results. I'm excited to guide you through this journey and to see you join the ranks of certified quality professionals making a difference in healthcare every day. I hope you'll follow through at the conclusion of this free introductory session and sign up for the rest of the series today. Why would you want to take the plunge and prepare for the CPHQ exam with us here at Convergence Health? And I will tell you, there is a Convergence Health difference. For starters, we provide maximum value for minimum investment. While other CPHQ prep programs charge nearly $1,000 for their live virtual sessions and for access to a practice exam, our Success Sprint comes at just $200 per person, only 1 hour a day for 4 consecutive weekdays. We have a comprehensive official practice exam that's included that you can take over and over and over again an unlimited number of times. And you have direct access to both myself and my colleague, Jen Wagner. We are nationally recognized industry experts and quality professionals who provided shoulder-to-shoulder assistance to quality professionals across the U.S. for decades. And exceptional results. I know that's most important here. Our proven methodology has helped hundreds of healthcare professionals achieve CPHQ certification over the past decade. Post-event evaluations from all of those sessions have consistently reported successful examination reports by the students and high participant satisfaction. So that's a convergence difference. Now, the curriculum for this course. Session 1 is actually today. That's this session. It's not a full hour long. It is on demand and it's free introductory session. During this session today, we're going to talk about 2 of the components of the CPHQ exam content, ensuring that deal with ensuring quality and compliance in healthcare. Then for those who would like to sign up and actually purchase the course, we will have 4 other sessions, each 1 day in a row for 1 hour a day. For session 2 is going to focus on quality leadership and integration in population health and care transitions. Session 3, we'll talk about data analytics and healthcare quality. Session 4, we go into performance and process improvement. And we save session 5, my favorite, for last, ensuring patient safety. So here's what you can expect. We're going to have live virtual instruction with interactive sessions with our expert faculty. You get that unlimited access to the comprehensive practice exam. We're going to give you proven test-taking strategies to maximize your score on the CPHQ exam. We can't guarantee you're going to pass, but we can guarantee that we're going to provide you with some great tips for taking the test here too. We are also going to have access to instructor support. You can reach out to us at any time, even if that means getting an encouraging call with us before you take the exam. You need a pep talk? We're here for you, in addition to answering questions. Now, Convergence Health is not affiliated with the National Association for Healthcare Quality, or NACU. However, we highly recommend that you take a look at their website at nahq.org, that you go through the materials that are there available for free regarding the CPHQ certification. NACU is the organization that has oversight over the certification, and so we definitely want to go to them to find out, have there been changes in the exam content? There aren't right now. I'm giving you the most up to date in this course here, but also some tips and tricks there. One of the things that you will find on the website in the list of resources for students who are studying to take the CPHQ is a book called HQ Solutions, the 5th edition. This is a great resource, even if it's not the 5th edition, whatever edition you have of this book. This is a fabulous resource, not just for taking the CPHQ exam and studying, but for anyone in healthcare quality improvement, because it's so comprehensive in the overview of the role. Now, it's not cheap, so understand if folks aren't able to get that. I think you can find older copies of it, perhaps on other websites, but perhaps you can get a used copy of it. But do highly recommend that you take a look, and if you're able to access that resource, I think it's a fabulous complement to this course here. Now, the actual live sessions are going to be starting real soon here. So session 1 is going to be that's the first option for purchasing this course. That's Monday through Thursday, April 21st through the 24th. Each day we will meet for 1 hour from 2 to 3 p.m. Central Time. If that week doesn't work for you, how about our next offering? Session 2 will be happening from May 5th to May 8th. Same time frame, same days of the week there too. And however you received this video, there'll be a link there to sign up for it that you can utilize and get directly signed up for this course. Now, I do need to give you a disclaimer. This course is designed to broaden understanding of the role that quality improvement plays in the healthcare landscape and the role that the quality professional plays in facilitating positive change in their organizations. And while this course is not going to guarantee success in the CPHQ exam, it does provide an in-depth look at the competencies and expertise necessary for quality improvement leadership. And again, Convergence Health is not affiliated with the National Association for Healthcare Quality, the organization that administers the exam. However, we are big fans. So why would you choose to become certified and become a certified professional in healthcare quality and carry that CPHQ designation? The CPHQ is a national certification that demonstrates a quality professional's expertise in healthcare quality and patient safety. It's considered the gold standard for certification in healthcare quality, and it validates knowledge and competency for healthcare quality leaders. The certification is administered through NAHQ, and more information about it can be found on their website. There's lots of benefits of becoming CPHQ certified. First of all, we know that CPHQ certification in quality leadership roles in healthcare organizations helps the organization to maintain quality standards. It also helps those organizations to improve the practice of healthcare quality and patient safety, because we have a lot of expertise now behind that certification. It helps you to enhance your skill set, and there are a lot of organizations that if you are looking to move up the ranks in quality leadership, this is a great way to add to your resume and showcase to others that you do have the expertise and skills necessary for career advancement. Now, there's 7 competency areas for the exam. These include quality leadership and integration, quality review and accountability, regulatory and accreditation, patient safety, performance and process improvement, data for healthcare measurement, population health, care transitions, you name it. You can see there's a lot that's covered in the exam content area. So our goal in this course is to parse out what's some of the noise. And by noise, I mean some of the additional foundational kind of information that is not necessarily going to be on the exam, and really point you towards what's most important for you to be studying and know prior to taking the exam. Now, a little bit about that exam. So there's a 3-hour time limit on it. There are 125 scored test questions, and then an additional 15 that are not scored. I can almost guarantee that if you are taking, when you go to take the exam, that there will be a question or two that you'll say, oh, I'm really not sure about this question. This doesn't feel like anything that I've studied. I really have no idea if I'm answering it correctly. That's a pretty good indication. That's probably one of the questions that they're just testing out and are not intending to score for this exam. So hopefully that provides a little bit of ease of concern about taking the exam. A passing score, however, does change with every single exam. And I don't just mean every year the exam is administered. I mean every exam. There's a bank of questions and there's different ones that are put into each exam. And so the passing score is based on the difficulty of the selected exam questions that go into your particular exam that you're taking. The exam may be taken online with a proctor if you are not able to visit a test center. The rest of them are done at testing centers that you sign up with on the NAHQ website. You must test within 90 days of your exam application, and you'll receive your score immediately upon completion of the exam. No waiting around for results. If you don't pass on the first time, that's okay. You can retake it again after 90 days. So the schedule that we're going to stick with for this course today, this on-demand free session is we're going to go through the exam content areas of quality review and accountability and regulatory and accreditation. Come back for the actual series, for the live series. Session 2, we're going to talk about quality leadership and integration and population health and care transitions. Session 3, we'll go into data analytics and healthcare quality. Session 4, performance and process improvement. And then finally, we're going to end with Session 5, ensuring patient safety. Okay, so let's get started now reviewing the first content exam area for this course, quality review and accountability. So what does that mean? So with an increased focus on transparency of and accountability for healthcare quality, outcomes, cost, and value, it's essential that the quality professional understands how current and emerging payment models impact quality improvement processes, outcomes measurement, cost, and reimbursement. The healthcare quality leader must guide their leadership team toward improved clinical and financial outcomes by implementing best practices to support compliance with regulations, standards, and policies for measurement reporting that advances quality improvement. So how will quality review and accountability show up on the CPHQ exam? While it's not going to be important that you memorize all of the agencies and measures and methods that quality activities and outcomes are connected to, it will be important to have a general understanding of the intertwined nature of a healthcare organization's activities and outcomes to payment for services. So let's dive in. First, we're going to start with the business case for quality. And I'll tell you, years ago, when I was first entering the world of healthcare quality, I would hear finances and business case in one sentence, and then the same sentence hear something about quality. And I'd think, what? In my mind, back then, I thought that finances should not be tied to quality. Quality was doing the best and the safest thing for the patient, no matter the costs. Yes, and what I learned as I started listening and learning is that I realized that my perception was a little off there. In healthcare quality, we aren't trying to cut costs like you might personally try to do by not going out to dinner or not buying non-essential things. We're lowering the costs by improving quality, meaning having great quality means you have lower costs associated with running your healthcare organization. Those costs are saved when the resources to continue the quality work or grow service line that the community needs or get a piece of equipment that will help us to provide more effective and efficient and safer care. And there's a lot of money on the table here, depending on the size of your organization, where you are within the United States. There's just a lot at play here when it comes to the business case for quality. There's even the Commonwealth Fund has found that US healthcare spending is 17.6% of the US gross domestic product. Other countries, their healthcare spending ranges from 8.8 to 12.8% of their GDPs. So there's a lot here at play that we need to be focusing on as quality leaders. So the business case for quality looks at the cost of not providing quality care. That's one aspect of the business case. So if you see this list of adverse events like adverse drug events or falls with injury or different kinds of hospital-acquired infections, and you see a cost associated with them. Now, we know that cost is a little challenging to be super specific with when it comes to healthcare. It's been one of the big challenges for a long time because there are a lot of factors at play. So these costs are a little bit simplified, but these come from a 2017 report from AHRQ, the Agency for Healthcare Research and Quality, on the cost of hospital-acquired conditions. There's a link to where this information is cited. It's in the slide here. So if you want to dig in further to how this information was obtained or calculated or et cetera, it's there. Safe to say, the cost of adverse events or hospital-acquired events is pretty great. And this is where value-based care initiatives comes in. Healthcare quality professionals are there to ensure that program data elements are attainable, relatable, and appropriate to the providers and the organization. Healthcare waste, like overtreatment, low-value care, failure of care delivery, failure of care coordination. We want to get rid of that. So value-based care is basically increasing productivity and efficiency to lower costs without compromising patient care. This can only be done in a culture of safety and quality, which is something that the healthcare quality professional helps to facilitate in an organization. I think that's the first time I use the word facilitate in this session. You're going to hear it a lot. In a little bit, I'll tell you why it's important. Now, another side of value-based care and the business case for quality is something that we call the triple aim. The triple aim was developed by the Institute for Healthcare Improvement, or IHI, and it focuses on three goals: improving the patient experience of care, quality and satisfaction, improving the health of populations, and reducing the cost of healthcare. Now, organizations approach meeting these goals by the value-based care delivery model, which prioritizes high-quality care and best possible outcomes for patients, while at the same time controlling costs. And so in value-based care models, from any type of payer source, we typically see financial incentives for high quality and low costs. These frameworks help to increase accountability. It's sort of a carrot and stick approach here too, by encouraging healthcare organizations to improve public health, lower costs while sharing the risk. Now, there's been an update to the triple aim, and that's the quadruple aim. This expands the triple aim in healthcare by adding a focus on provider well-being, our workforce well-being, alongside patient experience, population health, and cost reduction, recognizing that a healthy and satisfied workforce is crucial for delivering quality care. So one of the organizations that affects every single hospital, from large urban settings to small rural critical access hospitals or even rural emergency hospitals, is CMS, the Centers for Medicare and Medicaid Services. And no matter what, CMS is involved in quality improvement in one way or another in your organization. You may not know it, but they are. CMS has conditions of participation, or COPs, for each care setting. That's regular general acute care hospitals, critical access hospitals, skilled nursing facilities, long-term care, psych. There's, every type of healthcare facility has a different condition of participation. These are the federal laws and regulations for that healthcare setting. They're extensive, detailed manuals that talk about everything the organization must be in compliance with in order to receive their Medicaid funding. Now, I want to be clear that critical access hospitals have a slightly different funding mechanism. For them, most of their reimbursement comes from something called fee for service, meaning they are reimbursed for the quantity of services provided. This does increase costs, though. So we're starting to see more of a move, even in critical access hospitals, to this value-based version of care. CMS has also built a business case for quality that you see here on the screen. So this one is for general acute care hospitals, but I want you to have an overview and an understanding of how it works. So you see each of these columns here. There's for one side, every hospital must actually report data to CMS, just report data. It doesn't matter what's in the data, as long as they're reporting data into what's called the Inpatient Quality Reporting IQR program, then they are able to continue receiving their regular increases in Medicare funding. Then there are penalty-based reductions. So think of it like there's a basket of funding that hospitals can expect to receive from Medicare. However, if they have higher percentages than other like hospitals in hospital-acquired conditions like infections or falls with injury, things like that, they could receive a reduction in their funding. Same goes for readmissions. They're up to a 3% reduction in their funding if they have higher than average for like hospitals readmissions. Then there are what we call value-based purchasing, where there are other reductions. You might see some double dipping in reductions here too from a variety of ways, or hospitals might be able to earn more if they are performing better than other like hospitals. So this is where this business case for quality comes in, that there's actually a financial incentive to provide the best quality of care. Now, I want to talk also a little bit about what this section of the exam will cover, but really just in kind of basics here. There are no questions on the exam that are going to ask you to go into detail in knowing what any standards are, in knowing what the specific conditions of participation. It's about understanding that these things exist. That's what the test is going to cover. And so when we talk about quality is policy. Healthcare quality in policy is seen through regulations and standards that ensure safe, effective, and equitable care for all patients. It's seen in the profession. In the healthcare profession, quality is viewed as adherence to best practices, continuous education, and commitment to patient-centered care. It's seen in culture. Quality in healthcare culture is reflected in a shared commitment to excellence, continuous improvement, and patient satisfaction among all staff. It's seen in an operational mandate. As an operational mandate, quality is integrated into every aspect of healthcare delivery, from strategic planning to daily processes, and that's ensuring consistent high standards. And finally, it's seen in an organizing structure. So quality in organizing structure involves creating systems and frameworks that support efficient, coordinated, and high quality care delivery across the organization. And it is the healthcare quality leader's role to have oversight over these things, to facilitate these things. It is not the healthcare quality leader's role to do all of these things. So I want to make real clear that I want you to really start thinking about the term facilitation, facilitating improvement, facilitating strategic planning, facilitating decision-making in the organization as it relates to quality and patient safety. Now, while you are doing all of that facilitating, it's really critical that you understand some of the keys to effective communication. This is a real skill for quality professionals. And NAHQ highlights these concepts for communication. I want to talk about some of them that might not be specifically addressed in other components of this. So first, know your audience. The way that you talk about an issue or a challenge or a new initiative, it's really important you understand the audience you're talking to and you adjust your message to what matters to them. I don't mean lie to them, I mean adjust, because some different things are important to different folks in our organizations. And so it's important to understand the various aspects that matter to those different roles. It's important that we build a common vocabulary, that folks understand what we're talking about, that you provide the dictionary for that alphabet soup of acronyms that all of us in healthcare quality tend to utilize every day, every hour of every day. Reframe positive outcomes. And what I mean by that is when you're communicating about quality, don't focus all of your time on the bad things that happen. It's important that we cover those. It's important that we focus on those too. However, a more up-to-date approach to improving safety is by focusing on what went well, despite the fact that we are working in incredibly complex situations. Present best practices. That's going to come out different. The way that you visualize data for folks and tell the story through data is really key. We're going to talk about that during the data analysis session. And then you're continuing to build trust through your analysis and showcasing the relevance of the information that you're providing to folks. Just a couple of examples of how different messages speak to different people based on their role or their experience or how they're trained. So for instance, if you're talking about readmissions, patient care staff will probably be thinking about the severity of illness and the quality of care or the care transitions process. Speaking to someone in finance about it, they might be thinking about that reimbursement penalty. So understanding who you're communicating with is really helpful so you can tailor the data, the story, the message to one that's meaningful to your audience, from frontline staff members to your board members. And using a common vocabulary, sometimes different words mean different things to people, especially different departments or disciplines in the hospital. So limit that use of acronyms, use common language, and seek clarification there too. Another piece that's really critical is to consider transparency. Hospitals and other healthcare organizations have different levels of transparency for different stakeholders. And there may be specific requirements of transparencies for different stakeholders. But in general, when we're talking about being transparent, we're being transparent to patients by providing clear information about the quality of care, their experience, pricing, if available, to make informed decisions about their healthcare. That transparency there helps to build trust and empowers patients to be an active member of the care team and to really participate in this and have ownership in it. Transparency among healthcare providers, it really fosters a culture of accountability and continuous improvement. Sharing performance data and patient feedback can help providers identify areas for improvement and enhance the quality of care. Now, within our organization and with other healthcare organizations, we might be sharing information about organizational performance, safety measures, pricing structures with internal and external audiences. And transparency is really crucial there for maintaining credibility and trust. This movement towards transparency is what has allowed us to enter into the way that we approach quality improvement now in organizations with large-scale learning collaboratives. We have to be comfortable sharing with one another in a safe environment what we have learned about events that have occurred or what we've learned about how to drive improvement in the areas that are most important to us. Okay, so let's move on to the next exam content area for the CPHQ, regulatory and accreditation. So compliance with the laws, regulations, and accreditation standards is a vital component of the quality professional's role, and also the CPHQ exam. Now, it's vital that quality professionals are able to utilize their expertise to advise organizational leadership on myriad requirements and helping their organization attain and sustain compliance. This includes ensuring that there's an infrastructure in place for safety, quality, and performance improvement programs that support continuous readiness and understanding of the nuances of regulations and standards applicable to the healthcare setting. And I should clarify when I say it supports continuous readiness for surveys. We'll talk a little bit about those surveys in just a moment here. So some of the regulatory considerations for quality include the need for quality professionals to, one, promote awareness of local and national statutory and regulatory requirements within the organization. Now, no one is going to expect you to have them all memorized. However, they will expect that you are the person, the go-to person who can find out what those are. You know where to look. For the exam, there will not be any questions that ask you to regurgitate specific regulations or standards, so to just know that. There is a need for quality professionals in regulatory to develop, deploy, and support processes for evaluating, monitoring, and improving compliance with state and federal requirements. We also need to evaluate appropriate accreditation, certification, and recognition options. We have options for those in many healthcare organizations, and to maintain survey or accreditation readiness too. And so through this leadership commitment, individual accountability, organizational assessment, and robust survey procedures, the healthcare quality professional can promote the adoption and adherence to approaches to meet and exceed locally and nationally recognized regulatory and accreditation quality and safety standards here. So let's talk a little bit about what those laws, regulations, and accreditation mean. What does that mean? What are those things? So there's federal law. Those are bills that are passed by the federal government. They're also called acts. They can be found in the United States Code of Federal Rules in the United States Code. And then federal rules and regulations. These are rules that are made by executive departments and agencies within the federal government. The Code of Federal Regulations, or the CFR, is where CMS regulations are found. Remember, CMS, the Centers for Medicare and Medicaid Services, which is a very important list of regulations there. We can send out a link for those if you'd like to. And this is a valuable resource then for staying up to date on information on current regulations, proposed rules, et cetera there too. Now, there's also state laws and regulations. These govern healthcare at the state level. Frequently, they include things like licensure, certificate of need, privacy acts. Then we also have what we call quasi-regulatory. So these might be standards from accreditation agencies. They're usually more stringent, actually, than federal regulations. You go above and beyond with these. And one thing to remember is that all of these are dynamic and can change at different times. So having a means to stay up to date on what is proposed, finalized, et cetera, is critical to the quality leader. That is how this will be show up on the CPHQ exam. You'll be given some sort of situation, and it's about an organization that's getting ready to go through survey, or getting ready to ensure that they are following all of the conditions of participation from CMS. We'll talk about that in a moment. And it's going to talk about how the correct answer of the multiple choice ones will be that the quality leader facilitates this act of being up to date and being prepared to be surveyed. Now, there's lots and lots and lots of regulatory considerations and regulatory stakeholders in quality. As the quality professional, your role is in facilitating the understanding for the organization about any updated regulations and how the connection of your facility to the regulations may affect compliance or funding for the organization. So just having a general understanding is what's key here. You don't need to know every single detail when it comes to that, but you should know where to look or who to ask. And then you'll facilitate the organization being, you're gonna be tired of hearing that word by the end of this session today, but I promise it will show up in multiple test questions. Now, there are regulatory agencies, national public health agencies, and trade organizations, and really important, being accountable to the patients and families that have all worked together to create this national strategy for quality and patient safety. So again, not important to memorize them, just to know, have a general understanding that these exist. Now, normally in this section of the course, I spend quite a bit of time just going through many of the federal agencies and offices that exist under the Department of Health and Human Services. Not that the CPHQ exam will ask any questions specific to those organizations, but rather to give folks a taste of the various players in the healthcare quality landscape. And as this session is being filmed in April of 2025, these departments and agencies are undergoing significant changes, and the organizational framework is under construction. So I'm not going to spend time on this today, but I do recommend that you familiarize yourself with the changes to the agencies by visiting HHS, Health and Human Services.gov, G-O-V. The key points, though, for this portion of the exam for quality professionals are the following. It's important that you develop a process to receive, review, and communicate updates within your organization, since these laws and regulations change on a regular basis. It's important that you would become familiar with the federal and state agencies, as well as the CMS State Operations Manual. The State Operations Manual is the secret weapon in staying ready for surveys. It literally will walk you through exactly what a surveyor is going to ask and exactly what they want to see as evidence of compliance with whatever standard it is or condition of participation that they are looking at. And then be prepared for routine, unannounced visits from federal, state, or accreditation agencies to evaluate compliance with standards. We'll talk about that process a little bit next. And then finally, adopting a continuous compliance strategy ensures alignment with federal and state regulations, accreditation standards, and contractual obligations. Okay. So the phrase that tends to bring panic to multiple folks if you work in a healthcare organization is surveyors are at the door. The surveyors just entered the building. And quality professionals do play an outsized role in preparing a healthcare organization for and helping to lead through accreditation and licensing surveys. And as such, you're definitely going to find questions related to your role on the CPHQ exam. But fear not, though, you're not going to be expected to memorize every accreditation or licensing standard. Rather, you'll see questions that are related to your role in preparing the organization, like that you will again see some sort of scenario given about an organization getting ready to undergo survey, and it will ask what you'll have 4 options to choose from of what the quality professional's role is. One may have the word facilitate in it, so you know that'll be the right answer. Or you'll see other versions of describing that you're the facilitator of it. You're not setting standards. It is not just your role to ensure that everybody's up to date, or you share information, and you set up some sample surveys. You can share new regulations that have come out. You help other department leaders to determine their standing with those survey with a accreditation licensing standard. So that's what your role is for a survey, for preparing for it, and then during it and afterwards. Now, in addition to regulatory compliance, that's CMS, that's state licensing bodies, then we have the other accrediting bodies. And accrediting bodies have regulations that tend to go above and beyond those conditions of participation from CMS. So if an organization passes their accreditation survey, they are actually automatically awarded something called deemed status, which means CMS takes a look and says, okay, this accrediting body went in, gave them a clean bill of health. So we're also going to deem them that, yep, they still they are still abiding by the conditions of participation. So that just means deemed status just means that the organization's in significant compliance with the Medicare conditions of participation, and you're now able to receive Medicare dollars. So you might think, well, we don't have a very big Medicare population. Why do we want to go through survey? Well, unfortunately, where CMS goes, all other payers go. I wouldn't say unfortunately, actually, this is a good thing. All other payers go too. So it is very difficult to receive a contract with, say, Blue Cross or with, Cigna or any other private health insurance, even Medicare Advantage programs, and not have accreditation be a requirement there. So that's it. It is important. We have to do it. Now, there are lots of other types of accreditation. You might be magnet certified. You might be going through stroke certification. There's a lab certification that happens. So lots of different types of surveys. And it would be critical for you as the quality leader in an organization to understand the variety of certifications that you have or accreditations, and understand how often are we surveyed? How are we surveyed? Where are we right now with our readiness for it? So let's get into readiness. What's important with the CPHQ exam is that you understand that your goal as a quality leader is to help the organization to be ready for survey at any given time. So this involves staying updated on changes in regulations, conducting audits, and implementing necessary changes to maintain compliance. When I say implementing changes, I mean you're helping to facilitate the implementation of changes, in whatever department. It is really key that you make it easy for the frontline workforce members to speak the survey language. So I used to go around in preparing for survey with all our frontline staff and say, okay, so the surveyor is probably going to ask you about this. They might use these types of terms, this type of terminology or these phrases. I want you to know what that means here. In our organization, here's what that means. So please brag about the work that you're doing. Please talk with the surveyors, because we want you to be active and engage with them and describing how you work every single day to make your patients safe. The other key for quality professionals, though, is to be reviewing prior surveys. Every survey is going to have deficiencies. I mean, occasionally there's a survey that doesn't have a deficiency, but that's pretty rare. So it's really key that the quality professional says, okay, here's what the deficiencies were. Here's the action plan that was put in place. Here's how we've been monitoring it, and review it, because that is the first thing that a surveyor is going to ask you is, well, tell me about your action plan from the last survey and show me how you know that you're in compliance now. So that's key there too. It's also important that you would provide rationale for the rest of the organization for standards that might be a little challenging. and that rationale needs to go beyond it's just one of those things that CMS says we have to do, or the Joint Commission says we have to do it, or the state makes us do it. There's a reason beyond that. So it's really key that you connect that to the work that you're doing, rather than just saying, we have to do it because of CMS. And then really key is using a systems approach to mitigating any deficiencies that are found or that you're working on now. And what that means is it is everyone's responsibility. So we all work within this intertwined system in this complex organization that's providing healthcare. That means it's up to everyone to ensure that we're doing what needs to be done. And that is the role of the quality leader then, is to facilitate those conversations and those activities and have some oversight over them. So survey readiness in review for this CPHQ exam, for this portion of it, key points to know. Healthcare quality professionals typically take the lead in quantifying specific accreditation and certification related burdens, and they develop the business case for quality and patient safety. They must be familiar with reporting of adverse events or serious reportable events for their respective state departments of health and accrediting bodies. So those are, there are several rules and regulations in place, depending on the state where you live, for CMS, for your accrediting body, that specifically details where something must be reported if a sentinel event, if a serious adverse event, the big deal kinds of events must be reported, because that will come up also during accreditation and licensing surveys too. I will let you know too, then, in addition to that survey operations manual that I talked about for the CMS conditions of participation, your accrediting certification organizations also provide tools and resources to help your organization understand or evaluate compliance with the elements of performance. And make sure that you're finding those and utilizing those with your teams. And that means everyone in the organization, to ensure that you are continuously ready for any time that a surveyor walks in unannounced. Okay, so what's the next step then? We've gone to the end of the first two sections of the exam content for the CPHQ exam. The next step here, I want you to find your why. Why do you want to become a certified professional in healthcare quality? Why do you want to take the CPHQ exam? Or why do you want to take this course too, even if you don't intend to take the exam? Well, I want to tell you about my why. So I've been a nurse for over 31 years. Just over 20 of those years have been in quality and patient safety. So I was at the bedside for a while and came and left. I had to learn about my role on the fly. And I will tell you that it is a very common story. You have a nurse. That nurse works up the ranks in their department or in their hospital or in their organization, becomes maybe a manager or director, and then there's an opening in the quality department. And someone gets stuck. Someone says, "Hey, you'd be great in the quality department," and you get in there. Not everyone's a nurse in the quality department, but I'm saying this is a pretty common way to enter the field. Unfortunately, the other common piece is that there's not a lot of training. There's not a lot of support. I had that is exactly what happened to me. I had to learn all of it on the fly. I didn't have the benefit of a large system to provide training for the quality leader role. Instead, I learned through the stress of going through surveys, trying to understand the governance structure, how to describe our quality outcomes to the governing board, trying to understand the governance of the medical staff and how my role played a part in it, trying to understand how to get others to be interested in and engaged in quality improvement. It's my goal in life now to make education and professional development accessible to regular people like me. People who don't have the benefit of a large organization with deep pockets to pay for their professional development, people who truly want to make a difference in healthcare, people who know that the future of healthcare quality depends on all of us to improvement. That's why this course is priced at only $200. That's why this course is done in a really consolidated, accelerated manner, because I know that regular people like me really need that kind of assistance and support here too. So if you have found your why, I hope that you're ready to start your journey to CPHQ certification. And I hope that you will decide to join us April 21st through the 24th or May 5th through the 8th. Click the link that was included in the description of this event and sign up today. If you're still not sure and you have other questions, please reach out to me at any time. My contact information is here on the slide. I would love to chat with you about it and to encourage you to take this next step. So thank you so much, and I hope I see you in our next session.